moving forward with our program, and very honored to introduce to you Teirra Riggs. She is the Diabetes Prevention Coordinator. She is in the Cardiovascular Health and Diabetes section at the Indiana Department of Health, and she's here to share about some trainings and some resources that are available to you through their programs. So Teirra, I'm going to turn it over to you.
Hello and good afternoon, everyone. I am excited and delighted to present briefly some information about our online diabetes prevention program that we have excitedly named it Inspire Health. So just one moment here, I'm going to share my screen and I'm going to present with the PowerPoint. Okay, assuming you all can see my screen.
Yes.
All right, wonderful. I am going to go ahead and get started. So again, my name is Teirra Riggs. I'm going to actually take all of our wonderful faces off of here so that if I can find it, there we go. Okay. And I'm excited to talk about our National Diabetes Prevention Program. All right, so as you all have seen some of our other wonderful colleagues present our mission and vision for the Indiana Department of Health, so I won't go into too much detail. But essentially, this is how we work. This is the standard that I, as a diabetes prevention coordinator, stand on in terms of addressing the social determinants of health and in reducing the risk of type 2 diabetes within the state. Okay, so just some clear objectives here and what we're going to go through over the program. I'll first start off with a high-level overview of the department. What is the NDPP, or the National Diabetes Prevention Program? I'll follow up with the Inspire Health program specifically to Indiana, who's currently utilizing this program, the requirements to deliver DPP, why Inspire Health and why it's important, and finally the next steps. So moving right along, earlier I expressed the mission and vision as a health department, but allow me briefly to dive deeper into the mission and vision of our section, specifically the Cardiovascular Health and Diabetes section. We as a department are aware of the impact of prediabetes and diabetes. Therefore, we foresee all at risk to obtain high quality care. We are diligently working to reduce the burden of diabetes in Indiana through different avenues, including health system development, data surveillance, and health communications, regardless of race, ethnicity, and socioeconomic status, so that the best quality of life is possible for our Hoosiers. Okay, so moving on, what is the National Diabetes Prevention Program? Now the moment we've all been waiting for, right? The National Diabetes Prevention Program, otherwise known as NDPP, is a partnership of public and private organizations working together to prevent or delay type 2 diabetes. It was created in 2010 to address the increasing burden of prediabetes and type 2 diabetes within the United States. This national collaborative effort created partnerships between public and private organizations to offer evidence-based, cost-effective interventions that help prevent type 2 diabetes in communities across the US. The National DPP program is a CDC-recognized lifestyle change and research-based program that focuses on healthy eating and physical activity. This program has shown that people with prediabetes who take part in a structured lifestyle change program can cut their risk of developing type 2 diabetes by 58%. Research also corroborates that for those 60 years and older that participate in this program, they cut their risk of developing type 2 diabetes up to 71%. So here, the Indiana Department of Health, in collaboration with Kappa Health, is elated to announce that we have launched the virtual delivery method of DPP programming, specifically known as Inspire Health, capitalizing the I and N to represent Indiana. This is a snapshot of our direct website, which can be found at inspirehealthdpp.com. So participants who engage in this program, this is what they would see when they log in. So now briefly, I'll walk you through some of the unique offerings to this program. What is Inspire Health and what does it have to offer? So Inspire Health is basically an engaging online platform used to deliver the CDC's National Diabetes Prevention Program. Our unique offering allows sites who are interested in this platform to utilize it free of charge for the initial 2 years. After the 2-year mark, we are working with sites to continue sustainability and funding to ensure that the program is still live. Inspire Health enables all providers with an online platform with apps, iOS and Android compatibility, as well as content for the virtual delivery program of the National DPP. Inspire Health is complete with a curriculum, onboarding materials, videos, monthly roundtable discussions, makeup sessions, and ease of access. Inspire Health can help you to prevent or delay type 2 diabetes, reduce the risk of heart disease, lose weight, and increase one's energy. So who's utilizing this program currently? We at the Department of Health have been very fortunate to introduce this platform to sites and organizations across the state with variable success since its implementation approximately 6 months ago. There are a variety of providers who have adopted this platform, including employers, sites who already implement this program via a different delivery method, maybe it be in person or distance learning, which is the great thing about this program. You can have several delivery methods utilizing this DPP program concurrently. So for example, if a site is using this program in person, they can apply to have a separate delivery code and to deliver the same information exclusively online. We also have hospitals, faith-based organizations, and a local fire department using this platform currently. As I mentioned, again, the wonderful aspect of this program is that it can be run concurrently with different delivery methods. Again, for example, a site that has a cohort of participants exclusively in person, you can add another cohort of participants to use the Inspire Health platform because it's online. So what's required for a site or organization if they have any interest to deliver Inspire Health DPP? So listed here, we see there are several requirements that a site must have in order for this program feature to run smoothly and successfully. Listed here are just some key elements, including obtaining a lifestyle coach. And the lifestyle coach is the one who is essentially trained to deliver the DPP program online. You also need CDC recognition. And this is essentially a process that you would go through that is fairly simple. And this is includes a CDC approved curriculum and a trained lifestyle coach to help participants make lasting healthy changes. In gaining this CDC recognition, your organization must show that it can meet CDC standards and effectively deliver a proven diabetes prevention lifestyle change program. The CDC recognition process is fairly simple and seamless, and technical assistance is offered, which I am normally happy to walk our organizations and sites through that. We also here at Indiana Department of Health offer roundtable discussions every first Tuesday of the month for 1 hour. And this continual implementation support allows our sites to convene to discuss topics related to diabetes prevention programming. And this is hosted by Kappa Health, our partners who assist with implementing this platform. We also collaborate in offering program awareness campaigns, recruiting efforts, and onboarding materials. So once you commit to this program, you aren't alone. We are here and happy to help you and guide you through and to ensure your success. So why Inspire Health? As stated earlier, with the collaborative efforts, we are fortunate to be able to offer this unique experience to sites within the state of Indiana, free of charge for the first 2 years of programming. With ease in accessing the platform from various technology sources, whether it be the participant's phone, their tablet, or their computer, and it also being self-paced, this is a great opportunity for participants to engage in a viable program on their own time. Afterwards, we are looking into sustainability efforts and continuing to offer this program for free. Data supports that providers who use this platform for more than 2 years achieve full recognition from the CDC for online DPP. And finally, numbers don't lie, right? More than 5% of a cumulative body weight loss is sustained during programming, and more than 75% of participants commit to weekly engagement. So what's next? If you have an interest in Inspire Health, what should a site and organization do? Contact me as the state's diabetes prevention coordinator at the Indiana Department of Health. And from there, we'll establish a demonstration, give you a more detailed implementation process of how Inspire Health would work, how we may have to tailor it to your community and their needs, where you want to begin programming. Some may not want to immediately begin programming or disseminate it to their to the community. Some sites want to exclusively offer it to their employers, which is also an option as well. So we work through those avenues, create a template and an action plan for next steps. And then, of course, as I discussed briefly, if there is a means of cost, which it is not at the moment, we do discuss those barriers, and whether it be a cost barrier in regards to a site having issues with technology or recruiting materials and or engagement. We here at the Department of Health, specifically myself, are here to help you and navigate you through that. And so if you, last thing I like to say when I do presentations, because I am big on prevention, is that an ounce of prevention is worth a pound of cure. And so one of the things that I am an advocate for is trying to attack things before it gets to the point of no return. But I feel with diabetes, we are definitely at that point where we can tackle it before it moves further. And this is one of the things that Inspire Health has so graciously been able to implement and provide an easier way for our residents in the state of Indiana to receive the care that they need to prevent diabetes. So if there are any questions, I know I have staying within the time frame. I am here and happy to answer any questions that anyone may have, but I do want to say thank you so much for this time and allowing me to present Inspire Health, our online DPP platform.
Perfect. Thank you so much, Teirra. No questions currently in the queue, but definitely a program that we will continue to promote, because definitely diabetes prevention is needed within the state, since our state rates are pretty high. So just want to thank you for that. So if you have questions about the online program or want to talk to Teirra in more detail, reach out to us. We'll get you connected and get the program going for you. So thank you so much. One quick question did come in from Shalon. Do you partner with private groups?
Yes, Shalon. Yes, we partner with sites all across the state of Indiana. If you feel free to shoot me an email and we can definitely discuss further. I'm happy to do that.
Thank you. Thank you. Other questions? Perfect. Thank you. Thank you. So at this time, I'm going to turn